Today, we will be talking about the third phase of the peri-op period, which is the post-operative phase. This starts from when the patient leaves the operating room theater into the recovery area to be looked after by a well-trained nurse. Now, in the immediate post-op period, we are really worried about pain control, your ability to breathe for yourself and maintain your oxygen level. Some patients are sick with nausea and vomiting, and sometimes the blood pressure may either be too high, too low, and even the heart rate. So the patient is within our radar for a period of 15 minutes to 1 hour until we are happy that he or she is stable to be discharged to the ward. Now, the things we do during this period to ensure that stability is we ensure the patient is on regular painkillers, which could range from the simple painkillers to the very strong ones like the opioids. And sometimes the patient might also be on a regional anesthetic agent with some local anesthetic infiltration. The patient is on oxygen supplementation, and we still continue to monitor the oxygen levels. Now, the pain sometimes does affect the blood pressure, and the amount of fluids the patient has also affects the blood pressure. So if you don't have enough fluids, then your blood pressure could be low. We also give antiemetics to control the nausea and vomiting that some of the patients will experience. There's really nothing much the patient can do for him or herself at this period. So the nurse looking after you will interact with you and monitor your vital parameters and treat as required. Now, from the time you get down to the ward, that is when, your motivation and your level of activity does come into place. In some centers, and depending on the surgery that the patient has had, we engage the services of a physiotherapist who comes and helps the patient to start getting active. Now, since I started running this series, some people have shared the experience with me, and someone actually said, from her experience, the quicker you're able to get back to your feet, the better for you, and that is very true. Now, there is a tendency that, because of pain, the fact that you've had surgery, it's very easy for you to just recline in bed and stay laid down. That is not very good for you, because when you go to sleep, your lungs as well go to sleep, and it's easier for it to develop a chest infection. So we advise that, even in that first day of your surgery and, subsequently, try as much as possible to sit up in bed and then gradually sit out on a chair next to your bed, take a walk to the bathroom. But while you're doing this, make sure that, you have somebody who, can keep a close eye on you so that you don't lose your balance and fall. Now, do take breathing exercises. Just breathe deep and exhale. In some hospitals, we give patients what we call incentive spirometry. And this is, a toy that has 3 balls in it within a casing. And it has a channel where when you take a deep breath, you blow into it. And then depending on the force of your breath, you're able to get some of the balls up. This helps you to stretch your lungs, open it up, and it does very well. I'll also advise that, you cough, even if you don't feel like coughing up anything. It does, keep the secretions out, because this can become a breeding site for infection. It's also wise, to engage in little activities like getting yourself dressed in the morning, combing your hair, buttoning your shirts. This keeps, the fine muscles active. And also, staying in bed for such a long time is not good for blood flow. It's not good for pressure sores. With the blood flow, it's very easy to develop a blood clot, which could dislodge into your lungs, your brain, and even your heart, and cause, catastrophic complications. And if you're sat in one place for a long time, or even laid in a particular position for a long time, you could develop pressure sores. So it's very important that you do everything you can in that early post-op period to start getting your level of activity back gradually. The limitation to this is usually the pain, but with the regular painkillers, that may help. Remember that the pain cannot be completely eliminated. So if you're waiting for a complete elimination of the pain before you get up and about, that is not going to be possible. Just do as much as possible to get above and beyond that pain. Now, the other thing is your diet. A lot of people think, oh, because I've had surgery, I'm going to have to stay away from food for as long as. Now, if that surgery is not an abdominal surgery, and if the surgeons haven't advised for one reason or the other why you shouldn't have something to eat, immediately after the surgery, it's advisable to start taking sips of water, soft diet, and quickly get back to your diet. The limitation to that is usually nausea and vomiting, which can be caused by some of the painkillers prescribed. But we do give the anti-sickness medications along it. Now, you have to be careful to keep that surgical site clean and neat so that you don't get it infected. And the other thing is keep yourself motivated. Ensure that you keep up high spirits, because that is a period where you can have anxiety, depression, because a lot of things will be going on. So you will see that the outcome of any surgery, the experience in the post-operative period actually depends on what you have done in the pre-op period, preparing yourself, ensuring that your health conditions are well optimized. And then during the intra-op phase, the anesthetists, the surgeons, and all the team, they all work together and plan the technique to ensure that you have an enhanced recovery, because we are quite interested in getting patients up and back to their feet. Now, there are a group of surgeries that are done as day case, and what this means is that you go to the hospital the day of that surgery. After the surgery, you're also discharged home. A lot of surgeries are now done on day case basis, and it's quite important to let patients know that you should ensure that you have a responsible adult who will take you home after the surgery, because the effect of the anesthesia may still be lingering on. It's not advisable to drive, or you get a taxi. Have somebody to look after you in the first 24 hours and help you around the house. And you're advised not to make any important decisions. That's not when you should be writing your will or signing any contract. And stay off work for at least 24 hours after that surgery. So I'll be rounding up this episode and this series by saying thank you very much for keeping in touch, sharing your experiences, and I hope you've learned quite a bit. Do share this video with your family network, social and professional network. You never know who will benefit. We will be starting a series on a special group of people next, and that will be pregnant ladies. We will be looking at pregnancy, labor, and anesthesia. So please do stay tuned. Thank you very much.